I am the product of social mobility and financial progress. These are pictures of my great-grandparents. On the right-hand side are pictures of my great-grandparents who came from the Netherlands to this country through Ellis Island, looking for better opportunities. They landed in the fields to provide better opportunities for their family and their children. On the left-hand side are my great-grandparents on my father's side, who came through many, many trials and tribulations, who picked cotton for 5 cents a week and were just a step away from being sharecroppers living under Jim Crow laws, and told their children, go up north for better opportunities and better jobs. Things could have been different for me and my family. I'm fortunate. My parents were both first-generation college grads and made wonderful choices for me and my brother. But easily along the way, I could have made different choices, and certainly things could have been different for me. Things could have been much more similar to they were for hundreds of patients that I've seen over the years. You could be there now. You could be there too. Sitting at the table with a stack of bills, water, electric, trash service, that credit card full of charges for the start of the school year. You can't send the kids to school naked, right? Then there's that cable and internet bill, which maybe you could do without. You don't need your shows every night, but you need that internet, because what happens when the kids come home with questions that you don't know the answer to? I don't know what number bonds are, do you? And then there's that car payment, which you need, but realistically, the car was on its last legs before you even bought the car. And that's just what's on the table tonight. You don't know what else is going to come in. And you know what else needs to happen? Everyone needs to be fed. Your kids are looking up at you with those beautiful smiles, and you're full of pride. But your daughter is looking up with that smile only a mother could love. You know she needs a dentist, and probably an orthodontist. Your son, he definitely needs eyeglasses, and you know just by the way he's squinting when he's looking at the television. What is the cheapest meal for tonight, and then again tomorrow? It's your list of worries, a stack of bills, a need for medical care. Don't let anyone tell you your financial health doesn't have anything to do with the health of your family. It has everything to do with it. A study by the Congressional Budget Office has shown us that income in America is becoming even more concentrated today. The richest 10% are becoming even more rich and living longer. And the median are growing more slowly. And those who are born in poverty are having even more difficulty finding opportunities for jobs and education. Even more, we know that people are becoming even more concentrated in where they live by race and income. Pockets of segregation are bringing all of us down. We know that this means fewer opportunities for all of us to have better jobs and better education. The Urban Institute has studied this and modeled it. Gregory Axe has shown that if we could get to just average levels of segregation in cities like Chicago, this would provide better opportunities for everyone. And for blacks, it would mean that $2,400 more would be in people's pocket every year. It would mean that 80,000 more people would have college degrees, and the homicide rate would be reduced by 30%. This is a challenge, and this is what we need to work on. I'm a family physician by training, so I often think about patients that I've met over the years, and I'll tell you the story. We'll call her Miss Rivera for today. I met her in the clinic of San Francisco. She came into this country looking for better opportunities, escaping war and poverty. She had a third-grade education, had small kids, and was very hopeful. She also had diabetes. And every visit, we would try and try to get her diabetes a little bit better under control. And every time she told me, I'm doing so much better. But the reality was, it wasn't budging. I kept increasing her insulin up and up and up to the point that I really didn't think this was working. It wasn't making sense anymore. And it hit me over the head at that particular visit. I asked her, where are you keeping your insulin? And she said, it really depends on where I'm staying this week, which friend's house, and when I'm at a shelter, it's not possible. This is not uncommon. It is the social determinants of health that matter most, more than anything I learned in medical school. The World Health Organization has estimated only 10% of what I do as a doctor actually matters. It's everything else that makes a bigger difference. Jobs, income, transportation, housing, neighborhoods. It is these issues that impact health to a greater extent. And for the family that shares medicines because, well, the symptoms are similar, to the person who just grins and bears it and hopes the problem will go away, these are the issues that impact our health and the health of families more than anything else. Even more, we're trying to figure out how to address the chronic stress that debt can create. This chronic stress creates a toxic reaction in our bodies that can be measured by small molecules called biomarkers. It actually changes how our hormones work and creates the chance for stress to actually reduce the length of our lives. On top of that, it creates difficulty coping. People tend to do things differently, overeat, exercise less, maybe sleep less. On top of that, they may be depressed and coping by drinking alcohol or maybe even using substances or gambling. We can work on this together. Even more, we know that no matter what else we do, more than anything, income matters more than other factors like age and race. If you are wealthier, you live longer. On top of this study by the Robert Wood Johnson Foundation that showed that income matters, we've also seen in the reports of what people say in our country. The Gallup Share Card Report 2014 financial rankings also showed that people who are struggling financially are more likely than those who are less financially secure. And those who are thriving financially to report things like higher rates of obesity, high blood pressure, diabetes. On top of that, people who are thriving financially are more likely to report other positive behaviors like eating healthy produce, exercising, and maybe even sleeping better. People who are struggling report just those things that we talked about earlier. If you're struggling, you're more likely to report sleeping less, being depressed, anxious, and maybe having more difficulty managing your health. All of that puts you at greater risk for things like heart disease, cancer, and other problems that shorten your life. On top of that, this Gallup Share Card report showed that many people who are struggling financially do just what we talked about earlier. They're more likely to delay needed medical care, as 30% of people in America have reported. This is our opportunity to make a difference and help people where they're at and address the other factors that do certainly make an impact. We know that more than anything else, from studies about what type of job you have or where you live, income matters. We can do something about this. We can make a difference. We can coach people. We can stand by them when they need it most. In fact, in Delaware, this is just what we're doing through the Stand By Me program. Since 2011, we've had a program called Stand By Me, which focuses on financial empowerment. It leverages the capacity of local and state agencies, private businesses, philanthropy, nonprofits, colleges, and communities. It brings services to people where they are and where they're at and what they need most. It goes beyond just the basics of budgeting and saving, but it gives people the skills to maybe buy that first home or buy that first car. And it tells people how to avoid the dangers of predatory loans, get out of debt, and focus on everyday budgeting. Sometimes you need to know a little bit beyond the basics. Just like all of us. You have a car, and you need to know sometimes whether you need a major overhaul from the mechanic, or whether you just need to add a little oil or gas. We teach the basic indicators of whether you're on track and how you can thrive financially, how we can reduce that toxic stress, and how we can help people manage and also be healthier. In Delaware, I serve as Secretary of Health and Social Services, and I know we need to do more to go beyond the typical social programs. I know with federal leadership one day, we should be able to get to a place where we align our social programs, where we align welfare and food stamps and housing programs and what we're doing to provide people those supports when they need it most. When sometimes people just need a basic minimum rainy day fund. And we know the evidence is out there that people really just need cash and not governmental oversight. But until we get there, let's coach people. Let's empower people to go beyond just needing those supports in place. We can do this. We can do this together collectively, and we are doing it in Delaware. And it's making a difference. Since 2011, over the past 6 years, we've helped over 15,000 people. Collectively, we've gotten people out of debt that's totaled almost $7 million. People have saved a collective almost $1 million, and the average credit score has increased by 88 points. If you've been there, you know that's tremendous. And we can continue on this path by focusing on financial health. We're going to keep working on this together, and we can do this. We want a healthier community. We want lower rates of diabetes. We want fewer people with obesity and high blood pressure. We want fewer people using substances, and we want a healthier environment. We can do this by focusing on financial health. Financial health is public health. Trust me, I'm a doctor.